Okay, everyone, thank you so much for being here. Can everybody hear me? Okay.
Yes.
Okay, great. I apologize for our late start this morning. I had car trouble and had to run to USU's campus, so I really apologize. All right, let's get started. So you all know me. I'm Carrie Durward. I'm a nutrition specialist here at USU's campus, and I want to be talking today about the different nutritional needs that we identified as a group through the different interviews that I did with everybody. So I want to talk about kind of the common threads that came out throughout the interview, so the things that were mentioned the most commonly, and then talk a little bit about each of those issues more in depth. So we're going to look at obesity, diabetes, food insecurity, the need for Spanish materials or reaching out to the Latino population, and a request for ways to stay up to date on current nutrition information or hot topics. So the ones that we're going to talk about in detail today are topics that all had at least 9 people responding that was something that they felt was either a problem or an area that they'd like to see work done in. So 13 different faculty members mentioned obesity as being one of the top nutritional problems in their county. And 2 faculty members specifically requested weight loss or weight management programming as an area of nutrition education that they'd like to see me develop. Diabetes was also very commonly mentioned as a problem in the different counties. 10 different faculty members mentioned diabetes as a large problem. Quite a few of the counties have offered diabetes education in the past, usually in collaboration with RN or an RD diabetes educator. That was typically done using Nedra Christensen's Stepping Up to the Plate curriculum or the national curriculum Dining with Diabetes. So the problem here is that very few of these programs are still in existence. So I think only 3 counties are currently offering any sort of diabetes education, despite the expressed need for it. 9 county faculty members mentioned food insecurity, hunger, or an inability to afford the proper types of food as a problem in their country, in their county. And although several counties have good working relationships with the local food pantries or food banks and are offering cooking and nutrition education focused on low-income people through the Food Sense program typically, or through a commodity nutrition education based on the types of foods that people get at the food bank. Other counties have had difficulty attracting an audience at the food bank or networking with the people who work there. 12 different county faculty also mentioned either a need for translation of more materials other than the Food Sense materials into Spanish, or just a need in general to reach out to the Latino and Hispanic community. Many counties are trying to meet this need by hiring educators who speak Spanish, though in some cases people say that it is difficult to find somebody for the job with Spanish skills. And several counties also mentioned a need for further resources. They felt like their current funding and personnel levels, they really weren't able to work any harder to reach out to the Latino community. And then finally, another of the most common needs that I heard was a request for current nutrition information or hot topics. And so this was typically education for county faculty, though some people also mentioned a need, for information that they could take directly to the public. So people are asking for research-based information that is easily applicable. They're asking for timely information on current fads, trends, hot topics, new research that's coming out. And 13 faculty members gave me this request. So then we also had some responses that were less frequent, but I felt like were still important to talk about. So 4 to 6 people talked about a problem with access to nutrition food. So especially in some of the more rural counties where there isn't access to good grocery stores, or the stores that are there are small, the selection is limited, the prices are high. Several people reported to me that the majority of the people in their county actually drive to a larger city outside of the county to do the majority of their grocery shopping, and are obviously only able to do this infrequently. Some counties are able to overcome access issues through, specifically for fresh fruits and vegetables, through gardening. However, there's, the varying climate in Utah means that this isn't a viable option in all counties. 6 faculty members mentioned a need to increase fruit and vegetable intake. And 6 faculty members talked about a need to understand behavior change better, or a need being the ability to motivate people. So how do we get people to make these changes that we think should happen? And then finally, another relatively common response was a problem with people not having cooking skills, especially the younger generations. People said things like, younger families just don't know how to cook and stuff like that. And that was interesting to me because our current main extension nutrition programs focus on providing those skills, but it's still, beyond the ability of those programs, there's still further need. So even beyond the lower income population, for example. And then I had just a few people talk about some things, but I thought that they were interesting and pertinent. So I had a few people talk about wanting cooking information and recipes, programs directed at cooking for 2 people or 1 person. And so some people talked about that as kind of singles and students in dorms, and other people talked about it as seniors, as our parents whose children have left the home. Like I said earlier, I did have 2 faculty members talk to me about a need for a weight management or weight loss programming. But on the other hand, I also talked to several people who were running general wellness programs that weren't necessarily focused on weight loss, but were focused on being generally healthy in all aspects of your life. There were a few requests for research tools and assessments. This is something that I definitely want to address. It's something that I hope people will come to me when they have need, rather than just because it's very specific to what research questions you're asking. Exercise was something that a few people thought was a need that we should be addressing more. Several people talked about convenience cooking, the need for not only nutritious recipes and cooking education, but that it also be quick and easy. And several people talked to me about freezer meal programs and the need for great nutritious recipes for those. I think that's an interesting area to go into because I feel like it would be an easy place to do cost recovery, which we're being asked to do more of. Any questions or comments before I go on? Okay. So Utah historically and currently is one of the lighter states in the nation. However, we still have almost 25% of the citizens have obesity. and 6% of adolescents and over 8% of our youngest children. And just, we are one of the least obese states in the United States, but I don't think we should let that obscure the fact that we've seen a very dramatic increase in obesity. So we go from about 9% back in 1990 all the way up to the 23.4% that we were talking about. And this obviously, you've all heard the statistics, this has negative impacts not only on people's health, but also on the economics of our state. Some calculations estimate that obesity costs Utahns over $400 million in direct healthcare costs. So this is definitely a problem. It's something that the faculty members have identified. It's something that, if you open any paper, people will identify as a problem. But at this point, I haven't decided exactly how I want to address it, though I do think that this is an issue that I need to address as part of my programming. And the thing that I'm trying to decide between is whether or not we want to specifically address weight loss or weight management through programming, or whether or not we should address that through a more general wellness program that would not focus specifically on losing weight, but would hopefully also have that outcome. So this is something that I would really like input from the faculty members. It's kind of a follow-up question. Which do you feel would be more helpful in your county, and which direction do you think would be more effective? Something that I'm also looking into the research literature and best practices in other states and stuff like that to try to answer. So diabetes in Utah, so 7% of our population has been diagnosed with diabetes. We think there's another 2% of our population that has diabetes but hasn't been diagnosed. And 5% of our population has prediabetes, where they have elevated blood sugar levels, but they aren't quite to the point of diabetes yet. So that adds up to a total of 14% of our population having diabetes or prediabetes. The rate is much higher in minority, racial, and ethnic groups, specifically, Latinos and Hispanics, African Americans, Native Americans, and our Pacific Islander groups. In Utah, diabetes is specifically the 6th leading cause of death. However, this ranking is probably a little bit misleading because diabetes is a major contributor to risk for heart attack and stroke, relatively the number 1 and number 4 leading cause of death in the state. So we also have a large number of diabetic complications. Obviously, this is a serious disease, and when it's not controlled, we end up with complications that can have serious consequences for the state as a whole, as well as obviously the individuals who have them. So blindness can be caused by diabetes. Diabetes is the leading cause of blindness in adults aged 25 to 74. Amputation of one of the lower extremities, so the toe, foot, or leg. We have had over 300 hospitalizations where this has had to happen due to diabetes every year. That's an average. And heart attack or stroke. So on average, over 4,500 heart attack or strokes happen in Utah each year, which are related to diabetes. And those numbers are based on hospital discharge records. So it's possible that the numbers could be even higher. So I think diabetes is an area where Extension has a lot to offer. So typical nutrition education for diabetics is usually done either in a classroom or a clinic setting in the hospital, and they're not able usually or always to be able to show the application of the diabetic diet. So we all know to help people actually successfully make those behavior changes that we want them to, not just telling them what they need to do, but helping them learn how to do it. So learning the cooking skills, and then trying and being exposed to the diabetic friendly foods and meals, I think is a really important part that Extension can bring to the table. I do think it's best practice to collaborate with a RD or an RN diabetes educator, so that you're able to really cover medical nutrition therapy questions in detail. And this model, like I was talking about earlier, has been successfully implemented in the past in several counties. However, I would really like to see this expand and become a statewide program. And the other thing that I would like to see is for it to become sustainable. So a lot of people talk to me about, programs that they were able to run for 1 year or 3 years, grant money runs out, or the diabetes educator moves. And so to be able to develop a program like that, I would really like to put together an advisory committee of county faculty members who are either interested in putting together diabetes education curriculum, they want to implement it in their county, or who have previously or currently offered diabetes education in their county. I think by working together, we can capitalize on, the knowledge that's already inherent in the system and come up with a program that will be the most successful and sustainable. So food insecurity or hunger was another thing that was mentioned. And so food insecurity, we're talking about limited or uncertain availability of nutritionally adequate and safe foods, or limited or uncertain ability to acquire acceptable foods in socially acceptable ways. So the reason why I'm going through that definition is because a lot of places where we wouldn't necessarily think that people are hungry, they're still food insecure. So for example, a family that's on food stamps or is getting food from the food bank, we would consider that not a socially acceptable way to get food. And so we would still consider them food insecure, even if they are getting enough nutrition and calories in the short term. So in Utah, 14.8% of households, or nearly 150,000 households, experience food insecurity. And so this is an important topic for us to address because there are huge economic and health consequences. So especially when children experience food insecurity, we have huge deficits in growth and human development that we don't think can be identified later on. And then, into adulthood, we want to maintain our human capital. We don't want the negative effects of food insecurity to reduce the ability of our population to be economically productive. Health consequences, obviously, if you're having a hard time getting enough or enough nutritionally adequate food, so one of the health consequences is a nutritionally inadequate diet. General health seems to suffer. So for example, if you look at food insecurity in childhood and hospitalization rates, or if you ask doctors to rank, people's health, good, fair, poor, this correlates very strongly with food insecurity. And then obesity. So this is something that is getting a lot more attention recently. But there is a very high correlation between obesity and food insecurity. And so the issue here is people not being able to afford nutritionally adequate foods, and also is linked to the stress and mental health consequences of food insecurity as well. So obviously, Extension is already doing quite a bit to try to address food insecurity. So our nutrition programs that are directed at lower income people, Food Sense and FNEP, specifically talk about how to make the most of your food resources that are available and teach people techniques and educate them on how to reduce waste and cost while at the same time improving nutrition. Like we talked about earlier, some of the counties have also formed productive partnerships with food pantries. For example, they will have nutrition classes there. Sometimes people who attend nutrition classes will receive a coupon for an extra box of food as an incentive. This is an area where I'm still trying to figure out what our next steps are. I think one small piece of this can be the promotion of home or community gardening to increase access to fresh fruits and vegetables. Obviously, this is a small part of addressing the problem. I think it would be interesting to talk more about expanding some of the successful programs that work with the food pantries. And then, so those are two ideas that kind of, or the expansion of the current food pantry and commodity cooking programs, they help treat the food insecurity, right? So we're trying to provide enough food for people, but it doesn't necessarily solve the root problem. It doesn't necessarily prevent food insecurity. So I hope that we can have a continuing discussion about potential ideas to actually address the root causes and try to prevent food insecurity rather than just treating it. Okay, so another common thing that people talked about was either a need to reach out to the Latino or Hispanic community, or a need for more translation of materials into Spanish. So in Utah, we are now over 13% Hispanic or Latino in our population, and we've seen a huge amount of growth in the recent past. So there was a 70% or 78% growth in our Latino population between 2000 and 2010, and that is more than 3 times what happened with the total Utah population. So in general, the Utah population grew by about 20%, and so obviously we're seeing a much higher rate of growth in this population. You can see the map shows the percentage of Spanish speakers in the different counties. In general, in America, 12.9% of Americans speak Spanish in their home, and this seems to be pretty comparable to Utah, depending on which part you're in. You can see that we range from the very lowest end, 0 to about 4%, and about 4% to 11%, and then in Salt Lake County we have the highest level in the 11 to 21% range. More importantly, besides people who are speaking Spanish in their homes, reaching people who only speak Spanish or who speak English not very well, it is where the need for the translation comes in. And we think that about 3.5% of the population in Utah only speaks census. And so this is from 2012 in between the main census, so off-year census data collection. And the issue with this number is that we do believe that the census data under reports Spanish speakers, and just because of issues with immigration and legality. So some countries are offering Spanish language food cents. There are a few counties that are doing other Spanish nutrition education, but like I said, a lot of people are saying that that's a large need. I heard from quite a few people that there was a need for more resources and manpower to adequately address this problem. So I would like to suggest that we collaborate on writing a grant specifically to reach underserved Latino populations, and to do translation work, as well as hiring of more Spanish-speaking educators. So again, I'd like to form a committee where we can work together to evaluate need, write the grant, and research best practices to be able to address this problem. Okay, and then finally, one of the most common responses that I had was a need for up-to-date information on current topics or hot topics. So people ask for information on current trends, on new exciting research that's coming out, answers to common questions that they're having or common misconceptions, with a focus on research-based but still usable and immediately applicable information. So I plan to address this need by starting a weekly newsletter for county faculty and overlapping with a blog that's for the public. So I plan to draw information for the newsletter, items from the general news, from new research that's coming out, and then also include links to all of the blog articles from the week. I also feel like we can maximize our efforts here by using similar topics for the blog articles, as well as them becoming YouTube videos, newspaper articles, or fact sheets, which were also requested by faculty members. We also want to connect to social media. I don't know if anybody saw the recent opinion article, "The blog is dead, long live the blog," saying that blogs are on the way out and social media is really where things are today. However, I still think that there's a need for content to be housed somewhere. So that's why I plan to still do a blog. That's where the content can be housed. And then we can link to and share this information also through social media outlets like Pinterest, Facebook, and Twitter. So the timeline for getting this started is longer rather than shorter. I hope in the near future to continue answering questions on current trends or common questions that you have. I've received some requests from specific faculty members and have answered those in different ways, either through emails with that faculty member, or if a lot of people are asking it, also through an IVC presentation. And in the spring, I hope to apply for an extension intern to really help me put this together and get the blog moving. So some topics that people either mentioned in their interviews or have asked me questions about after the fact: coconut oil, genetically modified foods, the paleo diet, the gluten-free diet, sugar, high fructose corn syrup, probiotics. These are the kinds of things that we will hopefully be addressing in this way. So please do let me know if you have any specific questions, if there's things that you would like to learn more about, you would like a fact sheet on, you would like an IVC presentation on, or you would just like an email with a quick answer to a question. Okay, so the final area that I would like to address is fruit and vegetable intake in Utah. So I'd like to address this area because it applies to several of the less commonly requested areas, and so it really brings some of those common threads together and answers them at the same time. So on the right, you can see a map indicating on the top the number of people per state that are reporting eating fruit at least 2 times a day, and on the bottom, the number of people who are reporting eating vegetables at least 3 times a day. And so these are the Healthy People 2010 goals, and these maps were put together by the CDC in 2009 when they were trying to see how close we were to meeting those goals. So you can see here that about 1/3 of Utahns do report consuming food 2 times a day, while only about 25% are reporting consuming vegetables at least 3 times a day. So, however, when we look at how many people are actually consuming 3 servings, so not just 3 times per day, but 3 whole servings of vegetables per day, the number is much worse at only 16.7%. So I know we've talked about this before, but a diet that's high in vegetables is going to reduce our risk for chronic diseases, obesity, diabetes, cancers, heart diseases. So, cancer and heart disease, if you remember back to that slide about the leading causes of death, that's number 1 and number 2. Vegetables are very low in calories, they're high in fiber, they're high in vitamins and minerals, and high in phytochemicals. And so increasing the proportion of vegetables in the diet can really address a lot of the problems that Americans have, or things that we'd like to improve about their diet. So like I said, I feel like promoting vegetable intake addresses several areas of need. So we're indirectly addressing the issues of obesity and diabetes. I'd like to include a food provision or access improvement part of the program to address food security or access to nutritious foods. And this could take many forms. So talking to different people about community gardening, CSA type programs, or vouchers for farmers markets. And some of these might work better in some communities than others. And then wellness. So looking at promoting vegetable intake as part of a general wellness program. It would also include a cooking and nutrition education component to help people, apply, be exposed, and then continue to make a behavioral change. So that would address issues with need for more cooking skills. And then finally, I really would like to frame the research questions so that we can start answering some of these questions about behavior change and motivation that I hear a lot from people. So like I said earlier, I heard from quite a few people that, the biggest nutrition need in their county is to get people to, how do we get people to actually make changes? How do we get behavior change to actually happen? And although research is starting to give us some answers, and I feel like there's definitely some things that we can pull from the current research, there's also a lot of questions that need to be answered. And I feel like we can start to do that through a program like this. So in summary, please let me know if you'd be interested in being on either the diabetes or the Spanish Latino committees. I'll obviously be emailing people who talk to me about these sorts of things in their interviews. I hope that this will not be something that will add to your burden, but will help alleviate it. It's definitely something that I plan on taking the lead on, but I really feel like we can come up with much more successful programs through collaboration and using the information and the wealth of knowledge that's already out in the state. Please let me know if you have any questions or topics of interest that you'd like me to address. And please let me know if you have any specific input on the two different topics that I talked about that I'm still thinking about. So whether we should address obesity through a weight-specific intervention or a more general wellness intervention. And if you have any input on different ways that we can use to improve food security. So that's all I had that I wanted to share. I would love to take questions or comments on anything I've talked about or outside.
Hi, Carrie. This is Susie in Duchesne. I just had a question on if you'd had a chance to look at NIFA or any of the big funding sources are they going to focus on the obesity or the wellness, or have you had a chance to kind of see what's coming down the pipe yet?
Yeah, so NIFA just released their RFA, and my interpretation of the RFA is that there isn't as large of a focus on obesity as there has been in past years. And so I definitely want to talk to our program officer and get a little bit more clarification about exactly what they're looking for. But it looked like they were focused on whole foods and specific foods that can help out. So I do feel like fruit and vegetable promotion might fit there, but again, that's something that I'd like to get some input from the program officer about.
Okay, thanks.
Yeah.
And then And I heard over the weekend when I met with some folks, they had a little bit of information, but from what's coming down through the Affordable Care Act as well. But I
Right.
haven't had a chance yet to look at that one and see what kind of, where that's going to go. So, I'm going to check that question out more so I know. And then if I find
Great.
anything out, I'll pass that to you.
Great. I think that that's another great place to look. There are several different funding RFAs currently available through NIH, which do address a lot of these concerns. I think another area that I've talked about with some county faculty is CFAR as a way, as a funding mechanism for trying to address food insecurity. So there's definitely different grant opportunities out there. It'll just be trying to figure out which one is the best fit for the grant that we want to write. Other questions or comments? Okay, please feel free to email me any responses or follow-ups that come to you later. I know some of these are kind of things that I'm asking for input on are kind of big picture things that might, you know, you might come across something later or have a thought later, and please do email me with any of that stuff. Thank you all so much for your time today and when I was coming around and doing the interviews, and look forward to talking to you or working with you more. Were there any other? Okay. Thanks so much.